Good evening, everybody. Welcome to our annual general meeting for the year 2019-20. Thank you for joining us this evening. This is the first time we've ever tried to do a virtual AGM, so we're learning as we go along. What I would like to do is give a big welcome to Debbie, who is joining us today, and for the first time we have a British Sign Language interpreter who will be with us throughout the whole of the meeting. I'm going to spend some time talking through with colleagues the journey that we continue improving the care of local people, both in and out of hospital. Our community services and our acute services are both absolutely vital for keeping people well in Croydon. As we move into 2020, we're approaching the 10th anniversary of becoming an integrated acute and community trust. And I've never been prouder of the work that we've done in Croydon as an NHS. I'm really proud of what our staff have done in spite of the immense challenges since our last AGM. You won't be surprised to know that we'll be talking about COVID quite a lot tonight. It's affected Croydon in many ways. We were one of the areas worst affected in the early days of COVID. Thankfully, our position is much, much better now. We learnt a lot during that period, and it's worth reflecting on some of the learning from that period. The first thing that we learned was the immense commitment of our staff, nursing staff, medical staff, but all of the other staff that keep the hospital and our other services running, from porters through to cleaners. Really essential work has been kept going. The second thing I think we learned was that the journey that we've been making towards integration in Croydon, bringing the health service together and bringing the health service together with our colleagues in social care, has resulted in some real improvements. And it really strongly enhanced our response to the challenge of COVID throughout the very, very early days. But it also highlighted some weaknesses, both for us in Croydon, but nationally for the NHS. We have not done enough to tackle health inequalities, and that's apparent in the disproportionate impact upon certain communities. So we'll be spending some time talking today about the work that we're doing to tackle health inequalities. Health inequalities suffered by people from Black and Asian communities in particular in relation to COVID, but also those who are more economically marginalised. It's vital work, and I'm glad that Croydon is leading the way in this. We need to reflect also upon the many people who lost their lives, lost loved ones during the COVID crisis. And I'd like you to join me now for a minute's silence as we reflect upon those losses. Thank you. Whilst there have been so many sad stories, there have also been amazingly uplifting ones too. Later, we will hear from Panis Karyakar, a member of our IT team who caught COVID. He was with us at CHS in the hospital for more than 100 days, but showed amazing strength and resilience to recover and join us today. Next slide, please. Thank you. As you can see from this slide, we've had an incredibly busy year. More than 1,000 patients were treated for COVID in the hospital and then discharged into community care, both by our community services and also by our colleagues in general practice. It reminded us to be able to deliver high quality care, we need to be flexible, committed and collaborative. This was clearly demonstrated by the many staff who were redeployed at very, very short notice from their existing roles into a whole range of new roles on the front line of tackling COVID. So a big thank you to those staff and to our corporate teams who supported our frontline staff throughout the crisis days. We continue to invest in our staff, and recognising their achievements is one of our main priorities within Croydon. Every year we run Croydon Stars Award, and last year's was the most successful we've ever had. We received more than 300 nominations from colleagues of other members of staff and from members of the public. We think that that's a real reflection of the amazing work that has taken place across the Trust, by both teams and by individuals. Our staff are also proud to be part of Team Croydon. Feedback from our latest staff survey said 3 out of 5 of our colleagues would recommend CHS as a place to work. That's good news. Can we move on to slide 4, please? So we remain committed to our vision to deliver continuous improvements in the quality of care and have a safety culture that's fully embedded and integral to our everyday work. This is highlighted by 100 more Croydon quality improvement initiatives that have been introduced by staff over the past year. And we'll hear more about those initiatives from Elaine. In April, we became the first borough in the country to bring together the leadership of both the Trust and our local CCG, creating a joint executive team and many joint teams beneath that, leading the way for closer partnership working, both with the CCG, but across the health and care system. It also helped us deliver a balanced financial position for the first time in many, many years. And we'll be hearing from Mike Sexton, who will tell us about the finances over the past year. Coming together has meant that we've been able to renew our focus on population health. That's planning the care that people need and trying to ensure that they avoid unnecessary interventions, that we take care upstream and invest more in preventative work. This is captured fully in the Croydon Health and Care Plan that we published towards the end of last year. It was developed jointly by the Trust, Croydon CCG, Croydon Council and Age UK in Croydon. It sets out our ambitions and an energising vision as a borough to actively keep our communities thriving and supported whilst reducing health inequalities for all. We can move on to slide 5 now, please. Matthew will speak a lot more about our performance, but I'm extremely proud of our staff whose commitment has ensured that we're meeting a number of national performance targets despite very, very difficult conditions. That continues to be the case as we restore business as usual activities and deal with a backlog of elective operations. We've also introduced new services into the communities in Croydon, particularly for some of our most vulnerable communities. We opened the first female genital mutilation clinic for survivors in the country, and we launched that last September. As well as offering a range of care on site, it also has staff members who head out into our community to provide support to women who wouldn't normally access the service. And it's a partnership with third sector organisations, which is vital as we move forward into the future. We need to harness the strength of our communities and work with them in delivering a better Croydon. We can move on to slide 6, please. So we have many strong foundations from the last year, which we can build upon. In the coming year, we'll be looking to build on these results and help our staff work across organisational boundaries to deliver more joined up care in the borough. That's joined up between general practice, between community services, between the hospital between ourselves and the council, and also critically with the third sector. Our One Croydon 5-year plan is an example of how we can focus working with our community to provide care as close as possible in the heart of our communities. And we've opened our first integrated care network plus in Thornton Heath at the start, earlier this summer. I now need to move us on to some of the formal business of the meeting. So if we can move on to slide 7. The minutes of last year's AGM were sent by email this afternoon and are on our website. If anyone has read them and has any objections, could you please raise the objections now using the chat function? I'll give you a moment to make any comments, just in case there are any objections to those minutes. I can't see any objections being signalled, so I take it that the minutes of the last meeting are approved as an accurate record. I'd now like to move on to the 2019-20 annual report and quality account, which again can be found online on our website. And now we've got to do the same in terms of formally approving those at the AGM. So again, are there any objections to us proceeding? Again, I can't see any objections coming up through the chat function. So I'm going to say that we accept those minutes of the meeting. Before I hand over to my executive colleagues who are going to talk us through a number of key issues emerging from last year and a little bit about our plans moving into the next year, I do need to do a little bit of housekeeping. All the presentations will be online. We have a question and answer session towards the end of the event. Some of you have already submitted questions prior to the event, and you also have the opportunity to submit questions as you go along through the meeting. So again, please use the Q&A function if there are any issues that you'd like us to address in the question and answer session at the end. Again, as I mentioned at the beginning, this is the first time we've tried a virtual AGM, so we're still learning. Bear with us if there are any problems, and I've got my fingers crossed throughout the meeting. There are no planned fire alarm tests in our building, so if one does happen to go off, the presenter will inform you all and advise you whether we will be leaving the meeting. I don't, on this occasion, have to point out the fire exits to you at home. Finally, on behalf of the board, I'd like to thank all of our staff and volunteers across the trust. I'm hugely proud of the excellent team we have here at Croydon Health Service, and I thank them for their professionalism and tireless efforts to care for the people of Croydon. They've been tested in the fire of COVID. They came out successfully the other end. Thank you so much for your hard work over the last year. I'm now going to pass across to our Chief Executive and Place-Based Leader for Health, Matthew Kershaw.
Thank you very much, Chairman, and I would like to extend my welcome to everybody for tonight's AGM and endorse absolutely what you've said, Chairman, about the fantastic efforts of our staff all year. To that end, I'm going to take us through a review of... I'm going to try and take us through the review of the year. Hopefully everybody can still hear me okay. As it says there right up front, the pride that I see and that the Chairman has talked about, I think is heartfelt and something that I absolutely would want to start this evening's proceedings with. Every member of staff has worked tirelessly this year to deliver what we're trying to provide for all of our population of excellent care for all, and also support our staff in doing so. I'm going to move on to the next slide and take us through some of those highlights of the year. There's quite a lot of slides here. I'm going to just take a couple of points from each. That's to keep to time, but also these slides are a full comprehensive record and will be published and circulated for everybody to see. As I say, we're working really hard here in Croydon, to provide a service to our population, but also to make sure that we are supporting our staff in doing so. I talk regularly at our staff induction every 2 weeks, and I say our key job is to look after our patients, and to do that we have to look after our staff, and that's why, as it says there, we're trying to embed the values of the organisation. We're trying to learn from the experiences of both our patients and staff, engage and recognise the contribution of staff across the whole organisation, and work consistently to improve what we do, to improve the outcomes and the experience for both patients and staff. If I can move on, please. One part of that is to be really clear that we should be forthright in saying thank you to people for the work that they're doing, and to recognise and appreciate the staff for the hard work they do. We've had a number of mechanisms to do that this year, not least first responders, which is a really positive initiative, thanks to Elaine Clancy, our chief nurse, who's speaking later, for introducing that. We've just had our 1-year anniversary of that, and that initiative is a member of our senior team visits wards and departments right across our estate, so at the hospital site, but also at Purley Ward Memorial and in our community settings too. We take a trolley to offer our hardworking staff refreshments, and also an opportunity to talk with a member of the senior team and to check in how things are going, what's working well, what's not working well, what we can do to improve things. And that, as well as increasing leadership visibility and initiatives such as our thank you cards, are a really important set of initiatives to ensure that the engagement that we have with our staff is consistent, is comprehensive, and is just the way that we work. I apologise in advance, there's a number of slides here with my face on. That's never a happy moment. You can see me there serving dinner to our staff in the canteen, and many other initiatives beside, to ensure that that connection between the board and our staff on the ground is, as I say, as close as is possible. Next slide, please. Another initiative that we've had for a number of years is our annual Stars Award, and unfortunately this year, because of the pandemic, we were not able to run the event. We will be following that up when we're able to once again have a gathering in excess of 6 people, and to that end we haven't managed that this year. What we have, however, done and had is a huge level of appreciation of the NHS and care workers from the community here in Croydon. Clap for Carers obviously was a national event, was well supported here in Croydon, but we also had thousands of donations from local community groups, businesses and charities, and financial donations given on top of that, which we are starting to use to give some positive improvements for staff in terms of services, health and well-being, support for them as they get through the first phase of the pandemic and in preparation for the second wave when that arrives, likely later this winter. So really important that whilst the annual awards haven't occurred, that our appreciation of our staff and the appreciation from the local population has recognised those staff, and we are very, very grateful for them in doing so. Next slide, please. A really, I think, important part of this is about informing staff and not just doing that, but also engaging staff in what's going on in the organisation. And in addition to those opportunities for feedback in first response and other visibility visits to wards and departments, we've spent a lot of time in the last 12 months increasing our communications, formal and informal, with our staff, registering over 2,000 of our colleagues on the new staff app, and posting over 800 articles, using technology to bring people together and, as it says, engage with each other and our community, and indeed, really importantly, celebrate our achievements. There's a lot of positive things being done in the organisation. Sometimes it's difficult to remember those when we're also dealing with some of the challenges and difficulties that we have, but celebrating the positive achievements, a really important part of what we are doing with our staff to engage them so that they can feel more motivated to improve the care we provide to our patients and the support we give to each other. Next slide, please. The chairman's already referenced a little bit about the staff survey. We see this as a really important measure of how things are progressing across the organisation with regard to our staff. And we're now starting to see more staff recommending Croydon as a place to work, and satisfaction with the care that we're providing growing. And that's great. And we are positive about that, not least because this year, for the first time, over 50% of our staff responded to the survey. We want that to be higher in the year we are now in, and the staff survey is just upon us, so we'll be working hard to try and increase that percentage. The higher the percentage rate, the better the quality of information that we receive, and the more likely it is that we can then really address the issues that are of most concern or that people are most proud of within the organisation. And there are a number of areas where we can improve, and we are very upfront, honest and straight about that. We've got to do more about sharing learning, we've got to do more about health and well-being, and we've definitely got to do more on equality, diversity and inclusion, much of which we will be able to talk about a little bit more later on during this evening's event. So plenty more to do, but it is positive that we're starting to see some improvement in the headlines around the staff survey, and we'll wait to see what comes from this year's survey. Next slide, please. I always say that one of the great joys of working in Croydon, and it's almost my 2-year anniversary today, one of the great joys of being here is the diversity of the population that we serve and the staff that we have working with us. And we strongly believe that that diversity is a strength. However, for staff who are from a BAME background, or indeed people who are from staff who are from other protected characteristics, whether that be disability, religious beliefs or sexuality, there's work that we know we need to do to improve on our equality and diversity. We have a number of initiatives in play to help do that, not least the development of forums in all of those areas, which are providing a really important focus for staff to talk about issues that affect them, identify those where we need to improve, and also develop actions that do exactly that, improve the situation for our staff. So I think that improving equality aspect of our work was important in the year we're talking about here. If anything, it's getting more important as we go forward for a whole host of reasons, and this is going to continue to be absolutely at the centre of everything that we do. Next slide, please. I'm going to talk a little bit now, moving on from the huge contribution of our staff to some of the more detailed headlines of performance, etc., for the year 2019-20. You can see on the slide there that our hospital mortality rates, one of the key measures for overall safety in the organisation, are at the lowest level and therefore the best position for the past 5 years, and that we have done well in cancer care and in elective waiting times. Quite a lot of these things obviously more recently have been affected by coronavirus, more of which later, but in some of these key headline areas, our performance in 1920 was very positive, and we're very proud of that, rightly so. And in addition to that, our financial position has stabilised, and we achieved during 1920 the first surplus as an organisation for 5 or so years, and that is important as a underlying measure of the strength and robustness of the organisation. That's all positive, but in each of those areas there is definitely further room for improvement, and in one area around emergency care, despite huge efforts and significant work, not just in the organisation but across the whole system, and I'll talk more about that later, we were not able to achieve the 4-hour standard at just over 80%. We were unfortunately below the national standard of 95%, in line with many organisations across the country, and also missed our own planned trajectory of just over 90%. That obviously is a disappointment for us, and that has encouraged us to continue to look at ways that we can improve that, how we can innovate and change, and indeed on the back of some of the developments during the pandemic, we're now starting to implement some of those, and I will talk about those initiatives later on this evening when I come back and talk about the future. So that's just a bit about where we are in 1920 on performance. If I can go to the next slide, please. I'm going to talk a little bit now about not a reflection on what we did, but some of the things that we're starting to think about around transforming and improving our services, and crucially joining up our care and support across Croydon. Next slide, please. One of the things that I think marks Croydon out compared to other places that I've worked is in its innovation, innovation in a whole range of different fields. So our clinicians are definitely pioneering a number of treatments and techniques, the fit tests for bowel cancer screening being a good example, but also in education by developing new and different career opportunities, and in research as well. And the Silence study is one which we are fully engaged in here. It's a national trial to help us understand as a country more about COVID-19, and is another example of the way that innovation and research sit at the core and the heart of how we try to work here in Croydon. I think for an organisation the size of Croydon, our innovation and our research and development definitely is a stronger theme than I think the size of the organisation you would expect. So that is, I think, of great credit to the people who are involved in that. Next slide, please. Earlier in the year, we also officially opened our new emergency department. It actually physically opened at the back end of 2018, but we had the official opening in 2019. I think the really impressive thing about this unit is the fact that it was designed by our clinicians and supporting staff who work in ED, so that they could help to create the environment to which we could care for our patients, but also provide facilities for our staff that is becoming of a hospital in 2020. And they've done a fantastic job with that. And some of those people are now going to be involved in the design and development of other facilities around the site, not least our new paediatric integrated unit, of which I will talk more of shortly. Next slide, please. One of the really important aspects of Croydon Health Services is that we are absolutely an integrated provider organisation. I'll talk more later about our collaboration, but it's fundamental that we use this evening to just remind ourselves that the community aspect of our service is crucial to how we run services for the benefit of our patients. Over a third of our staff work in the community, and as you can see there, we have a very, very significant size of service provided in the community and in people's homes. The Life team, Living Independently for Everyone, has seen a absolute huge increase in referrals over recent times with COVID, but we have made huge efforts to be able to respond to that, and the team have done amazingly well. I've visited that team on a number of occasions, and the support they provide to the patients, but also to colleagues who work in the community, whether they be GPs or social workers or the voluntary sector, is absolutely first rate, and we are extremely blessed to have a team such as the Life team forming a big part of the way that we run our integrated services across the borough. Next slide, please. In terms of collaboration, I talked about it a little bit earlier, and I know the chairman did as well. We very much feel that we are at the forefront of collaboration and partnership working both in the NHS and across health and care. We do that not because we think collaboration or integration is a fancy thing to do. We do it because we think it is the best way to improve people's health and care, because by doing it, we can break down the barriers that might exist between organisations and professional teams. We create opportunities for staff to have different and we think more varied and interesting careers, and crucially, from a patient and a general population perspective, it shrinks and reduces and hopefully removes the gaps that have historically existed between services. And in all my experiences, if there are gaps between services, that's where patients and the public fall between them, and their experience of care, and indeed on occasions the outcomes of those care processes, can be worse. And so we're working really hard to make sure collaboration and integration is at the heart of everything we do. Next slide, please. One of the ways we've done that is by aligning the NHS in Croydon into a integrated team, and bringing together the Croydon Health Services executive team and the team from the Croydon part of the South West London CCG has been, I think, a really important initiative, and one with appointment, as you can see on the slide, of a joint chief nurse, a joint finance officer, a joint appointment of in strategy transformation and in planning and integration, as well as myself as overall place-based leader. Is the first time that's been done in the country, and we are learning as we go about what works with that and which areas we need to do more to improve it, but what it is doing, I think, is making us all think about whole systems, integration, better ways of working, and by doing that, it's the first step to then delivering those benefits for our patients and indeed our staff. So much more to go, but I would endorse the work and thank everybody involved in doing it. It's been hugely interesting and challenging, but also hugely important, and much more of that to come as we go forward. Next slide, please. I'm just going to finish off with a couple of three slides before handing over to Elaine Clancy. I couldn't talk today about the organisation and the system here in Croydon without just reflecting a little bit about our response during COVID-19. The chairman has already mentioned some of this, and we're going to have some reflections from other colleagues and indeed from Pani, one of our patients. But certainly in my nearly 30 years in the NHS, the pandemic has been the biggest challenge over a long period of time that I will have seen, and it's been an opportunity for us to change fundamentally some of the ways that we work, but it's also I think given us some great examples of just the amazing things that our staff and indeed the people of Croydon have done at this time. Next slide, please. So our staff right across the board and indeed our volunteers went well above and beyond what you would expect to care for the patients during the pandemic. And when we say care for the patients, that's not just patients in hospital, the community element of our response. And I would say, whilst this is an annual general meeting for Croydon Health Services, the contribution of the social care sector, our care homes, our GPs, primary care made a massive contribution to how we've managed coronavirus, and it should not be ignored, even though tonight is focused on the Croydon Health Services. Croydon Health Services couldn't alone and didn't alone respond to the pandemic. We did that as a collective, and that is, as I said, one of the strengths of working in Croydon, and we were well blessed during that first period of the pandemic with that close working, and that continues today and will do as we go forward. As it says there, we had a gold response to the pandemic, which meant that we focused very senior management time to overseeing the pandemic, making the decisions that we needed to do on a day-to-day basis, and allowing our teams to get on and manage the patients and indeed themselves during that period. And I'd like to take the opportunity to thank Elaine and the whole team who worked so tirelessly over that period. And of course, that work continues. We redeployed staff, we developed childcare facilities to allow people to continue to work. Staff stayed away from home and volunteers from the local community, and indeed, as you can see from some of the pictures there, colleagues from other industries came to help out during the period of the first wave of coronavirus, and cabin crew staff from British Airways and Virgin made a real contribution to the overall service that we were able to provide to the patients who unfortunately were struck by coronavirus. Next slide, please. I've talked a little bit about this before, but the work in Croydon as a whole place, I think, was actually, despite it being so difficult during that first phase of COVID, it was a joy to behold the work that was done in the way it was done with all partners, local GPs, care workers, mental health services, voluntary groups supporting and working with us here in CHS to address the needs of our population, whether that be continuing to support the vulnerable people of Croydon, with check-ins from GPs, with targeted support for shielded patients, of which there were a large number in Croydon, of course, and the sometimes unseen challenges of something like COVID on those with serious mental illness or learning disabilities. And I think that, along with support for the care home sector and with particular needs in Croydon around homeless health, are some of those areas that you don't always hear about in response to the pandemic. A lot of focus around critical care, quite rightly so, but some of those other things equally important, and for some people more important than what goes on within hospitals. Next slide, please. So during the whole pandemic, important to say the scale of the challenge for us. In London as a whole, there's been just over 45,000 confirmed cases, over 2,000 of which have been in Croydon. That's a big number in Croydon, and it happened very quickly in Croydon as well. And over 1,100 people have been treated within Croydon's hospital over the outbreak. The vast majority of those treated successfully and discharged. Unfortunately, and Mike was absolutely right to take a moment at the start of today to remember all of those who have been affected and sadly lost their lives through coronavirus, and obviously our thoughts are with those families today and will be going forward. We're going to talk later with Pani, who I can see has just joined us, to reflect a little bit of his experience of being a patient and now recovering at home from the virus, and really pleased that he's able to join us and share with us his thoughts later. Next slide, please. So we talked a little bit about it earlier, but just very quickly, looking after patients with coronavirus requires us also to look after our staff, and there's just a few examples there of the things that we've been able to do. Pictures with people on face masks were never imagined to be such a thing, but this year we're getting used to it. So you can see there how with fruit and with many meals provided by local businesses, that we've tried to look after the physical health of our staff. Really importantly, however, also looking after the mental health of our staff. Treating patients with coronavirus has been, in some cases, a very traumatic experience, and a whole range of measures that we've introduced and continue to provide today to look after the mental health of our staff, so that they can continue to look after the physical and indeed mental health of our patients has been crucial and will continue to be so. Next slide, please. We've also worked really hard during the pandemic to continue to provide a safe service to our patients and indeed for our staff, and that's around infection prevention and control, and we're all getting used to the face coverings, the hand washing and the social distancing. That is absolutely crucial for us all, whether it be at work or indeed out and about in the community. We also have had to make some really difficult decisions at the start of the pandemic about restricting visiting. Positive that we've been able to relax some of that with appropriate guidance around infection prevention and control, and with some limitations still, but really important that we try to open that up and re-engage patients with their relatives, and that's something that we will be developing more of over the coming weeks as we get into the next phase of the pandemic. And then to my last slide, please, just to remind you that obviously we have to remain vigilant at this time. You'll have seen only yesterday on the news the further developments of the coronavirus and the restrictions that we all need to adhere to across the country to protect yourself and your nearest and dearest. So washing your hands, wearing a face covering and keeping a safe distance. We're continuing to do that here in CHS, and crucially, that's important, A, to protect ourselves against the virus, but also to allow us to start returning some of our planned care services so that we can catch up some of that work that we absolutely understandably had to slow down and stop in the first part of the pandemic. Much more on that later on this evening when I come back and finish off when I start looking ahead for the remainder of this year and the future. So that's all from me for now. I'm going to pass over straight away to Elaine Clancy, our Joint Chief Nurse and Executive Lead for Midwifery and Allied Health Professionals.
Thank you, Matthew. It is indeed my privilege to be the Joint Chief Nurse here in Croydon, and I'm going to take you through the quality report this evening. Quality runs through everything that we do. It's the way we learn from what we've done well and what we've not done so well. And a large part of this is having the teams, processes, systems in place to make it easy and structured as possible for our staff to deliver high quality, safe, professional care. And this includes the teams that deliver that and support me and the executive team with that. So over this year, we've refreshed the function of the quality and senior nursing team by appointing some responsible directors to support that work. And to take action to put patient experience at the heart of our improvement and implement new systems to help staff log incidents, risks, and to feedback. A really good example of that for us is our ward accreditation scheme, which we've been piloting recently on 3 of our adult inpatient wards. And that looks at how we can empower our teams to get the basics right and gives them the opportunity locally to make improvements in their own area. And once they've seen the benefits, we can quickly start to roll that out to the rest of the wards. And indeed at Croydon Cares, which is something that we run every week with our senior nursing and midwifery and AHP staff, we had a really good presentation about how the ward accreditation scheme can work, how it looks and what the data looks like to be able to support our staff locally, the multidisciplinary teams in improving care for our patients. I think I've moved ahead in terms of my slides. Apologies, colleagues. Can I have the next slide, please? Last October, we were visited by our colleagues in the CQC as part of their routine unannounced inspections of trusts. They came to the trust over a period of 4 days and inspected a number of our inpatient wards, our diagnostic and imaging, both here on site at Croydon University Hospital, but also down at the Purley War Memorial Hospital. And they inspected our critical care unit as well as our urgent and emergency care departments. Overall, they rated us as requires improvement. And this is what we as a trust and senior team had already self-rated ourselves as. We know we have significant work to do, but what it did was give us a benchmark of knowing where we were, where we are, and what work still needs to be done to get us from good to outstanding. That's our aspiration. One of the areas that we were really disappointed in was to see that our care rating had moved from good in 2018 down to requires improvement, and that was very disappointing for our staff. This, we believe, was a result of a number of factors, including a drop in the number of people completing our friends and family tests and some challenging inpatient survey results from the previous year. However, we're really pleased that inspectors reported seeing our staff delivering kind and compassionate care during their visit. We've already taken action in a number of areas, despite the challenges of COVID, and we know there's still more work to do. And I'm really keen that next time we have our future inspections that we'll see a lot more green ratings on this grid. Next slide, please. I wanted to give some more detail, a little bit more detail in terms of what the CQC found, and the report was published earlier this year. As you can see, we received some positive feedback on caring for our communities in a timely way, where we exceeded national targets, as Matthew's already alluded to, for referral to treatment times, cancer, and shorter waits for our diagnostic imaging than the England average. We received some good feedback in terms of a positive culture and shared values, with staff saying they felt supported and valued, and that managers promoted a positive culture and common purpose. We demonstrated our strong multidisciplinary team working, both internally within departments and, as again Matthew's alluded to, with our partnership working with health and care providers across the borough, helping to minimise waits for our patients. Outstanding practice was noticed in critical care and children's emergency department in terms of training, where we demonstrated exemplary education for staff development and information sharing to drive improvement from a dedicated internet portal through to multidisciplinary simulation courses for our staff. However, we know we could do where we need to do better. We need to get some of our systems and processes right to give us access to timely, correct and reliable data to inform our decisions and evidence the progress that we're making. We also need to ensure that none of our patients experience delays in being admitted, transferred, or indeed discharged home or to a further care provider. We continue to embark on competitive and ongoing recruitment to nursing and our allied health professional roles, including our paediatric teams to support our safe staffing at all levels. And finally, we need to concentrate on ensuring we focus on the detail as well as the big picture, managing our day-to-day performance alongside our ambitious plans for integration as part of one of the One Croydon Alliance. We've already taken significant action in many of these areas and have robust quality improvement plans in place that are monitored weekly by a team of multidisciplinary colleagues. We've already seen improved systems and processes in the emergency department to improve our patient experience, to maintain our safety and reduce our waiting times. We've had a continued recruitment drive, which has seen more than 100 doctors and nurses join the trust over the last 12 months. We've strengthened our clinical and operational leadership with new roles to give more support to frontline teams and give clinical leaders greater control in the daily running of services, including, as I alluded to, the Director of Quality and 2 Deputy Chief Nurses, an Assistant Medical Director focusing specifically on our community services. This seems, and as we move on, you'll see some of the other ways that our teams and individual colleagues are championing quality improvement to better the experience of our staff and our patients, some of them that Matthew shared with you already, something we know will help us to increase our performance in many of these areas. Next slide, please. I've already alluded to the inpatient survey in 2019. The Care Quality Commission surveyed 434 adult inpatients who stayed in the hospital overnight, and the survey showed some clear improvements across the trust since 2018, which is a positive. We still know we've got work to do, but we were heartened to see some improvements. Alongside its full inspection, they published the CQC published their annual survey, and we're pleased with the survey results and some of the improvements we're making. And some of the improvements have been in particular in privacy and dignity in our A&E department. The report, which was published, which was completed last year, highlighted some of the areas about ensuring that our communication information is clear and timely, and patients experience kind, compassionate care every day. And when it's time for them to go home, they know what to expect and are given advice and guidance on their daily living and what to do for their aftercare. The findings was just a snapshot of the experience of the thousands of people we care for, but it mirrored what the CQC had told us. We're supporting local leaders and clinical teams to develop plans to improve care in their own areas, empowering our staff to take action and share their successes. And one of those things, as I've alluded to, is the ward accreditation. We're also working on improving our discharge processes. We know our patients tell us we don't always get that right, And while we're pleased to see a reduction in the number of patients who reported a delay in their discharge, we know we need to ensure that we utilise the borough's strong partnership working between health and social care to provide a smooth, informed discharge for all of our patients. These results highlight that when we put our mind to things, we can make positive changes. We're now one of the top 10 improving trusts in the country, and we need to use this to bolster the work we're already doing, ensuring we all take responsibility for delivering excellent patient care every day. The next inpatient survey is due to be completed in early 2021, looking at inpatients who will be staying with us in November 2020, with all the challenges potentially that may bring us this year as we continue with the pandemic. But we're hopeful that some of the changes that we've been working on and that we've made will be demonstrated when these results come out next year. Next slide, please. In terms of children's experience surveys, we again have seen some improvements, and we saw a positive trend in feedback from our younger patients. We scored higher in 34 out of the 54 of the questions since the last survey in 2016, making us England's most improved trust as rated by young people and their families. I'm really excited about our potential to improve this even further, as we've recently started work on a very ambitious project to transform our care for children and young people in our new paediatric integrated unit. I won't steal Matthew's thunder on this occasion, so I know he's going to tell you more about that later, but we're thrilled that this is now underway and we'll be able to provide even better care and even more services for Croydon's children. Next slide, please. Our final results for the year, I think we've missed one, maternity. Our final results for this year are maternity, which were just as impressive, was the CQC's maternity survey, and that was published in 2020, February this year. For the first time, women were asked questions about their mental health support given by midwives throughout their maternity journey. And I'm really pleased to say that CHS ranked within the top 3 trusts in London for asking mothers about their mental health as part of their postnatal care. We were placed in the top 5 for providing London with information about potential changes to their mental health after having a baby. And as part of the care that we provide, we have a mental health specialist midwife on site offering dedicated support to women with complex needs and sharing advice and expertise with the midwifery teams to ensure that every woman in Croydon gets the right care for them, both physically and emotionally. The feedback from new parents also praised other aspects of Croydon's maternity care. While we can be proud of many of these results, there is more work to do to ensure that expectant mothers get the best possible care throughout their maternity journey with us. As part of our commitments to the Maternity Transformation Programme, we'll continue to work closely with our new mothers, our own staff and our local community to ensure we continue to deliver in the areas we're doing well and improve in the areas that we need to improve on. Next slide, please. Infection prevention and control. As again Matthew's alluded to, and as we've talked about COVID and infection prevention control, this has been a big part of our year. But I'll take you through some of the other infection prevention controls measures. The first one is C. diff, where 24 cases against a maximum of 23. So we had a target of 23, and unfortunately we missed that by 1 case. But we review all of those cases robustly and across the system. It was an increase in what we wanted, but we've developed a robust C. diff action plan and worked with colleagues and our consultant microbiologists and pharmacists in terms of improving those numbers. We saw an increase at the beginning of the year, and because of the dedicated multidisciplinary work that we did with the clinical teams, we managed to reduce our cases of C. diff. Our MRSA cases, we had 0, which I'm really pleased to report. And for flu, we had 766 cases during the winter season, which was a 10% reduction on the cases of the previous year. For norovirus, we had 7 lab confirmed cases of the virus, which is a nasty virus causing diarrhea and vomiting, which was significantly down from 17 in the previous year. Matthew's already talked about COVID and our response to COVID and some of the infection and prevention control, and you can see some pictures there of the team demonstrating and educating our colleagues in terms of what PPE to wear for different scenarios. We had throughout the pandemic and continue to have daily IPC and PPE meetings through the Gold Command and through me as the Director of Infection Prevention Control to monitor the situation. Next slide, please. CQI is Croydon Quality Improvement. It's not just an initiative or a scheme, it's something we want to embed as a thread that runs through everything we do here in Croydon. It was launched in July 2019 and we've had a significant number of cases and projects that have been registered, and they continue to grow, reflecting the commitment of our staff to take forward their ideas, collaborating with others and delivering continuous quality improvements across the whole pathway of care. There's clearly enthusiasm for this work from the teams, and in the last year we've seen almost 100 projects registered from colleagues across the Trust, and over 10% of these have already been implemented, starting to make a real difference to patients and staff. We've also trained over 150 members of staff in quality improvement. These range from just a few hours of introductory training right through to an intensive course run by NHS England, which provides accredited teaching associates training to be able to train all of our staff. Our ultimate ambition is to provide the way we work methodology to facilitate excellent care for all at both an individual and population level across Croydon health and social care system. So in the coming year, we'll be doing much more work to roll out CQI to our partner organisations with the hope of seeing real change across the system. Next slide, please. We've also been incredibly busy with clinical research and innovation. And this is my final update on quality for this evening in terms of the support for clinical research and innovation. This year, we've recruited 833 patients to take part in almost 50 studies, including a prominent sexual health trial and the BUMP trial, which monitors the risk for pregnant women with high blood pressure from preeclampsia, which is a dangerous condition for pregnant women. Earlier this year, we'd heard the story of Hayley and Andy, who don't mind us sharing their story, a Croydon couple who'd sadly lost their son Freddie to stillbirth back in 2018. When Hayley became pregnant again in 2019, she signed up to the BUMP trial and was able to monitor her blood pressure from home, helping to identify any potential risks throughout her pregnancy. Hayley, who worked as a wedding and entertainment coordinator, said the support she received from our teams during the trial reduced the stress and anxiety, and we're delighted that she gave birth to a beautiful baby girl called Poppy. It's always fantastic to see the results of these trials and the rollout of new medicines, treatment and equipment thanks to their work, but by far the best bit is seeing the impact that this research can have on patients themselves. We're really keen to keep these fantastic stories coming throughout, and we look into the rest of this year and ahead into 2021, there's likely to be plenty more. We're already taking part in some of the major COVID-19 trials and are set to change lives and ultimately save lives as we learn to live with the virus. There's a significant amount of studies that we're involved in, and as we all learn from COVID-19 and the virus and the pandemic, we will continue to work with colleagues across the UK and across the system to be able to respond to the virus. Thank you for listening, and please do feel free to ask any questions. We'll be answering any questions or clarifying anything at the end of today's AGM.
Thank you. So, hello, my name is Dr. Nano Suji. For those of you who don't know me, I am the Medical Director and Deputy Chief Exec, and it is my privilege to talk to you about a really important topic, which was important pre-COVID, but has really been spotlighted through COVID. So the title today for the AGM is about combating health inequality in Croydon. And I think it's really quite symbolic that Deborah is here with us. And as I say that, I will try and slow down so that we can stay on track with the translation as well. Next slide, please. People talk about health inequality all the time, and I just thought it was important for us to take a minute and really describe and define what we meant by that. We talk about raising the bar on health, and that has happened to a large extent in the UK. But in improving health outcomes, we've also widened the gap between the outcomes of people who are seemingly equal. So this was a definition as I was pondering this yesterday. Health inequality to me speaks about the differential and, really importantly, avoidable differences in health and well-being outcomes amongst people who are otherwise equal. We spent a lot of time talking about this in a COVID context, but it's not new. It's something we've been aware of for a long time, and we can look at infant death rates and see the difference in outcome between people from different ethnic minority backgrounds. Similarly for pregnancy, where women from a Black and minority ethnic background are 5 times more likely to have a negative outcome through pregnancy. COVID hasn't created these inequalities in our borough, but it's truly shone a light on them for us all to see, and more importantly, for us all to sit up and take action on. Next slide, please. Many of you will be aware that Croydon was one of the earliest hit and one of the hardest hit boroughs in London. And again, my own personal sympathies to those whose lives were lost, but also to the substantial number of people whose lives are forever altered by what they went through COVID. We know that COVID shows no prejudice. You can get COVID no matter who you are. But there are things around our choices, our behaviors, our health-seeking behavior, our prevention behavior that will impact the risk of acquiring COVID. What we do know is that the risk of passing away from COVID has been shown scientifically and statistically to be different depending on a number of factors, some of which are to do with demography, our age, our deprivation, some of which are to do with gender, with men having a worse outcome, some of which are to do with existing conditions such as diabetes and obesity. We do know that these show a differential outcome, and that conditions such as diabetes and hypertension are more prevalent in Croydon. And to a large extent, given the diversity of our population and the prevalence of these conditions in Croydon, it was unsurprising that we were hit as hard as we were. Next slide, please. The question around health inequality is one that doesn't sit only with ourselves as healthcare providers. It sits with the wider system. One of the real important aspects of us being an integrated system in Croydon. 80%, if not 90% of a population's health and well-being is linked to non-health aspects. It's linked to transport, it's linked to housing, it's linked to income, education, and skills. And these are things that are legacy and generational. Our ability to impact one individual potentially will have life-changing impact for generations to come. Next slide, please. Before COVID hit, we came together with many of you to devise a plan that highlighted what we wanted to do for Croydon people. And I say we because it's us as providers working with people in the community. Our priorities were set then, and they haven't changed. They've just been highlighted and amplified. Our focus is on maintaining well-being and on proactive care. We know that it is better to prevent than it is to cure. It also focuses on unlocking the power of communities. And we know that it's not always those people who present or who speak up or who have the loudest voices who have the greatest needs. We also know that accessing different aspects of community are best done by people within the community, and using our community and voluntary assets in a better way is part of our prioritization for the health and care plan in Croydon. And lastly, to develop services where they're needed in the heart of the community, so that people have access to care that's joined up from start to finish. These priorities remain and are emphasized post-COVID. Next slide, please. And so the question becomes, what do we do? And what do we do now? As I was pondering again last night, I spent a lot of time thinking, as you can see. There's a lot we need to do in terms of knowing our data. And that's not just about meaningless information, but really knowing what the needs are for our population, what the differences in access and outcome are for our population, and understanding that not just at the level of the individual, but looking at the population as a whole. So part of our commitment and the work we've already started with partners is about a population health database, so that we can look at a glance and identify people who have one or more comorbidities, that is different diseases, or cofactors, different elements, all of which lend to a differential outcome in terms of health and well-being. We also know we need to commit to ensuring our data is complete. So working with primary care colleagues, we've committed to ensuring that data on ethnicity is more robustly collected in primary care as well as in secondary care. The second commitment is around engaging our people. We've already spoken about the importance of community and voluntary assets. And I was pleased to have been part of the first, hopefully of many, workshops where we worked with our BME forum, giving information about diabetes and hypertension. I hope many of you would have been there. And what was really helpful was that it was a joint up approach between ourselves as a secondary care organization and our primary care colleagues. So it was hospital and GP doctors working together to give information. Really useful session. The questions were really pertinent, and hopefully the opportunity for change really material. The third element is around how we use the information we have now to prioritize as we move forward and protect and anticipate. Some of those elements are specific to conditions we know are modifiable. If you think back to some of the conditions we spoke about, none of us can change our age, much as we may want to, or our gender, much as, I better not say anything there, much as many people may want to. We can think, however, about conditions that are modifiable, and that is around diabetes and hypertension. So working with colleagues on a London, Southwest London and Croydon basis, we've looked at how we can prioritize patients with these conditions to provide anticipatory care before any future waves. Additionally, how we prioritize these patients through that contact around preventative elements such as flu vaccination. I was also delighted to have introduced routine testing for HIV, again coming back to prevention being better than cure, and having been able to identify people at early onset of their condition where we can make a difference and where life expectancy can be normalized. Next slide, please. As a trust, we are the largest employer in Croydon. We have a real responsibility, an obligation, an imperative as an anchor organization to be actively driving some of the changes that will allow us not just to raise the bar for health, but to narrow the gap in terms of inequality. The title of this talk is Combating Inequality, because I don't see it as a passive step, but as an active step. And I also don't see it as something that resides only within the hospital, but also in each and every one of us around the decisions we make, around the opportunities we create, and around the legacy we choose to leave. So I thank you in advance for your partnership in working to reduce health inequalities in Croydon, and please watch this space, we'll keep you abreast. I'm going to hand over now to Mike Sexton, who will take us through our finances.
Good evening, everybody. I'm Mike Sexton. I'm the Joint Chief Financial Officer for Croydon Health Services, but also for this reporting period, Croydon CCG as well. And as I was reflecting on the presentation, it took me back to 2 years ago when both Croydon CCG and Croydon Health Services first made the firm commitment to come together and to commit to joint financial performance and to align financial incentives across the system. And we spent 6 months planning to do that and budget setting together, a year doing it and delivering it. And now we find ourselves in the point where we were very successful in that first year, and we have more ambition to go forward across health and care in the system. I wanted, in reflect of the quote on the slide, I just wanted to emphasise the really strong belief that I have that quality and financial performance go hand in hand. And as quality improves, so does financial performance, making our services to patients just that much more sustainable. The slides I'm about to take you through are effectively a summary of the financial report and annual accounts that are in page 72 of the annual report. If I go to the next slide, this slide highlights our financial performance for the year. And as I highlighted, we had set a joint control total or financial target for the year, which was a 2.6 million surplus to be achieved across Croydon Health Services and Croydon CCG. And we absolutely did deliver that target. The Trust's contribution to the surplus was a 0.4 million surplus, and that was achieved by delivering over £11 million of efficiency savings within the Trust, and allows us to continue to deliver services in a stable, sustainable way to the population of Croydon. There are a number of other financial targets we have as well that I've noted down the bottom, and we have met the majority of those: is capital expenditure, cash management, return on investment. We were weak on public sector payment policy, which is how quick we pay our suppliers and creditors. But I can assure you we have made significant strides in improving that in the last 6 months and continue to do so. As you'll be aware, our accounts are externally audited and assured, and in this case our external auditors are Grant Thornton. They have provided us with a true and fair view opinion that is unqualified, which is success. Our value for money opinion has improved from last year to what's known as an except for opinion, which highlights that although we have made significant efficiency improvements, we do still have an underlying financial challenge that takes us into the future, which we are continuing to address. And overall, that's a very, very successful financial performance to report back to the public. We go on to the next slide. This slide highlights our work in partnership. And as I alluded to in my introduction, we are in a unique position in Croydon where we have brought together both the CCG and the Trust, and recognising the significant overlap in financial resources, with the CCG being funding the Trust to a degree of around 70% of the Trust income comes from the CCG. And that's really paved the way for us to spearhead using the finances to bring the organisations together. And it's also allowed us to see the joint benefits of various initiatives that we've ran through 2019-20. For example, working with primary care and secondary care to make elective services at Croydon Health Services the priority of the provider of choice for local GPs and patients. And that was a very successful initiative. And working collaboratively across primary care, pharmacy and hospital pharmacy to reduce over-the-counter prescribing. And as we move forwards, further ambitions around partnership working, which have been alluded to earlier in the presentations. So firstly, working within Croydon, this time with the council to integrate finances around health and care, but also across the hospital system within South West London, where we bring together back office functions, be they recruitment, procurement, and other initiatives that are coming together. I go on to the next slide. This slide is a summary of what we've spent our resources on this year. There is definitely more detail within the annual report for those that are interested, but of our 345 million that was spent in 2019-20, over 60% was spent on staffing, and in addition, another $1 million spent on education and training for those staff. Our resources are spent on both acute and community services, as has been emphasised during the presentation. It's noted on the right-hand side of the slide that we have increased the spend in Croydon, and this is partly a product of the growth in Croydon patients coming to Croydon Health Services for their active care and choosing to be cared for in Croydon locally. If I go on to the next slide. A key feature of the financial plan each year is capital investment, and this is investment in IT, medical equipment, estates, so buildings, to support the delivery of high quality services in Croydon. And in particular, last year, significant investment was made in equipment around X-rays, ultrasound units, etc., and also significant investment in IT to facilitate efficient care to patients. And of particular note was the success in securing 12.7 million Prime Minister funding for modernisation of our critical care unit. If I go on to the next slide, and linked to the capital programme is the finance response to COVID-19. So as we all know, in March 2020, just at the end of the financial year, and running into April and May, the Trust had to invest around 1.2 million over that crisis period to increase critical care capacity at very short notice and extend essential oxygen supply to meet the demand from the critically ill patients. And this was achieved by all teams across the Trust at an incredible pace and was delivered very successfully. We have also successfully attracted, over the COVID period, significant investment into the Croydon care system. So social care, continuing health care in the community to ensure patients are discharged as quickly as possible without delay to ensure acute facilities are available for the COVID patients that require acute care. In terms of the future, it is important to note that the financial regime that has operated for many years up to the COVID crisis was suspended, and for at least for the first 6 months of this 2021 financial year, the priority has been meeting the needs of patients, and trusts have been funded on a cost reimbursement basis. We're now moving into a phase from October to March, where there will be a gradual introduction of capped funding for local services, and we're in the process of working that through locally. If I go on to the next slide. which I believe is charitable support. As you know, the Trust hosts charitable funds that are the product of donations to Croydon Health Services for the benefit of patients and staff. Certainly the COVID crisis has put a spotlight, and there has been an outpouring of generosity to the charitable funds to support staff and patients through the COVID crisis and in the post-COVID crisis. There are many donations coming in locally through our Just Giving website. Of particular note is funding coming through from NHS Charities Together, which is Croydon's share, if you like, of the £30 million raised by Sir Tom during the lockdown period. And that we're very, very grateful to have those funds flowing through. And we're in the process of spending those funds, as highlighted on the slide, for meals, wellbeing treatments, but also more initiatives that we can roll out over the remainder of this financial year. If we move on to the next slide, which is my closing slide, just to highlight looking ahead for the next 18 months. As I highlighted on the first slide, we were very successful in 2019-20 in our financial performance, but we do have significant financial challenges as we have quality challenges that we continue to improve against. That mean we will need to refocus post-COVID, post-winter to address those issues. We have been very successful in the past at achieving quality improvements and cost reductions, and we will continue in that vein as we go forward. And on the right-hand side is a number of areas that we will continue to look at to make services sustainable for patients in the long run. I would also highlight during the COVID period, although we have had the turmoil thrown at us, we have maintained really strong financial governance and reporting and controls within the organisation that both ensure financial control but ensure we're responsive to the needs of clinical teams and patients and able to support suppliers as well. Thank you very much for your time, and I will hand over to the next speaker.
Thank you, Mike.
Thank you very, we haven't got that seamless as we would like, Matthew. I was going to say a big thank you to the executive team for their presentations, and just to mention the three executives that didn't get a speaking session today, Josh, Neil and Michael. We're going to move on to the patient story now, and as Matthew said earlier, Penny was with us for 100 days, so it's a fantastic, Penny, that you're able to join us.
Thank you.
Tell us a little bit about your story. Thank you.
Well, my name is Penny, and I spent a total of 98 days in CUH under intensive care and also Wandle 2. So the intensive care part, from going into hospital to the end of the 40 days that I spent there, I have no recollection of at all. So it's a complete blank, and that includes 10 days before I actually went into hospital. My wife tells me that the doctors were exceptional, not only looking after my well-being, but also her well-being. I can't sing their praises enough or thank them enough for getting me through. I nearly died 3 times from bleeds. Survived that, and they took exceptional care for me. I mean, the first time I realised I was in hospital was waking up after 40 days, not being able to move or talk. So it was very emotional when I woke up, because I didn't know how many days I'd spent in hospital. I'm presuming the stress on people looking after me would have been high as well. Not only, and my wife as well would have been under a lot more stress. I was asleep, not knowing what was happening, but I can assure you that people around me were working quite hard, and I appreciate that. Obviously, after I left intensive care, I went to Wandle 2. There I was picked up by the physios because when I woke up, I wasn't able to actually move. Couldn't talk, couldn't move. So I had to relearn everything, and the physios and the staff and the occupational therapy were brilliant. I can't fault them enough for their care. I'd like to thank them personally, one by one, but still trying to get over this, and there's still a fight ahead. Don't know what the long-term consequences are to my health, which is a worry in itself, but I'm glad to be here and be able to tell people my story and maybe make people aware that even I'm not saying I was the healthiest person, but I wasn't unhealthy. It can hit anyone. And I thought it would be just the flu symptoms because that's why everyone else got it. I didn't think I'd get it this bad. So it was a bad time in my life, and I hope no one else goes through what I went to spend so much time in hospital, and also thinking about people that lost their lives as well. And I'm one of the lucky ones that can speak out on behalf of us that have survived it.
Paddy, thank you so much for sharing that story. It's great to see you looking so much better than when you left us. So your recovery is still progressing. I'm so pleased that the care that we gave you was good, but really, really important was that the support that you mentioned that we gave to your wife. Please do give her our very best regards. Penny, thank you again for sharing that story. It was really moving, and I think your words of warning for everybody are really, really important as we move into the winter and what we know will be a bit of an upturn in COVID infections. Penny, again, thank you so much for sharing that tip tonight.
Well, thank you for the opportunity to share my story, and hopefully I'll be back at CUH working one day.
We hope it's not too long before we see you back here again, but you get yourself better first.
I will do.
Take care.
Thank you.
Bye-bye now.
Bye-bye.
Thank you for that, and I think it was really important to share. I'm going to ask Matthew to give us this is a bit of a spoiler for next year's AGM. I'm going to ask Matthew to give us a few headlines of the work that we're doing as we move forward, just in headline terms, so that we can get a sense of what we might expect to see at next year's AGM. Matthew, over to you.
Thank you, Chairman, and I'd also like to thank Pani for staying with us and sharing his experience. He's an example to us all, so well done you, Pani, and as I say, look forward to seeing you back sometime soon, but in the meantime, recover well, look after yourself, and really important message you gave about the impact it can have on people, so thank you. Just very quickly, the chairman's given me a subtle steer to do this in headlines rather than take more time. Apologies to everybody that we are running a little late, but what this is just to try and give a bit of a flavour of some of the things that we're going to be doing in the year ahead, in the year we're now in. Obviously we will, as the chairman says, cover some of these in more detail at the next AGM. So for those of you who can't wait, here's a little taster, but we look forward to welcoming you next September for our review. Next slide, please. So obviously at the moment we have a lot of work going in to think about the second wave of COVID and linking that to winter. So we are fully in preparation mode. We remain ready, willing and able to respond when and if the demands of the population require us to on coronavirus. That means us as a whole system. As I said earlier, it cannot be the hospital and our community services alone. Primary care, GPs, care workers, mental health service, voluntary groups and the community itself need to be a big part of our work on the second wave. So that is going to be a really important flavour of the next period of the health and care service here in Croydon. Next slide, please. Just some very quick headlines. One of the things that we're doing linked to the experience that Panny's had is that recovery from coronavirus is as much of a challenge in some cases as the initial stages of treatment. And so we are doing work now on joint initiatives to help our population manage and cope with the long-term effects of COVID-19. And that, again, is going to be a really important initiative led by one of our respiratory physicians, Yogini Raste, and more on that this time next year, I am sure. Next slide, please. It's not just the emergency side of work within a hospital that's important, also integrated community networks. They, as referenced already this evening, a really important initiative for us, which brings together all of the agencies in the community-led network, which will help us to focus on prevention and proactive care, picking up some of those issues both Elaine and Nena referenced. We've started that in Thornton Heath this year. It'll be a rollout across the whole of Croydon, and we are very, very excited about the benefits that that can bring to our local population. Next slide, please. One of the issues in the first phase of the pandemic was that we stopped elective care, and that was understandable and right at that time, but planned care is important, and in the second part of coronavirus we are going to absolutely continue as long and as much as we can to deliver planned care, and to help us do that we've created what we call the Croydon Elective Centre, and that's a new dedicated area of the hospital with its own entrance, with staff who are focused on providing care in that environment, and patients who have been screened as COVID clear before their treatment. That's a really, really important initiative for us. It's allowing us to get right at the top of the list of organisations in London in the amount of planned care that we're able to do, and that is really, really important for the thousands of patients who we look after on a planned basis. Much more on that next year. It is a huge part of what the next stage of managing COVID is going to be. Next slide, please. In addition to that, digital first, looking at the way we run outpatients virtually. 4 out of 5 appointments are now offered through that mechanism. It's really important that 1 out of 5 isn't, however, because it's not appropriate for everybody. It's not some patient's wish. It also is not what doesn't work for every patient. So having a blended approach is going to be important, but using new technology, fundamental. Apologies again for the poor modelling on the right hand side, but what I'm demonstrating there is a monitoring technique to look at patients' vital signs, which allows them to be assessed and monitored in their own home, rather than coming up to be an inpatient or indeed to an outpatient facility. Again, thinking about how we can make our services more accessible to patients, more convenient to patients, but the same high quality that they should expect. Again, more on that next year. Next slide, please. And emergency care and the way that that is provided. I referenced it in my earlier presentation around some of the challenges that we've had with emergency care. That's obviously therefore a real priority for us going forward. We've got some further funding. We've looked at different ways of working in a whole range of areas. I would just flag here the Call 111 First. That is an initiative that Croydon is piloting, one of 5 services across the capital that is testing that. There's a few early adopter sites around the rest of the country, so we're right at the forefront of this, and this is about patients being able to phone 111 first before attending for urgent emergency care, and then being booked into a slot to see somebody in the urgent treatment centre, a GP hub, a pharmacist, or go onto the triage list for a GP practice. These are ways to try to manage and book and give some certainty to patients in terms of when they'd be seen for urgent and emergency care. It also, we hope, means that we'll have less people waiting in waiting rooms, where there is obviously, you know, an experience issue for patients, but also in the current climate, a greater risk of infection during those times. So a really important initiative and an example of the many ways that we think we are working on to transform our emergency care. Really important based upon the challenge we had last year, and I look forward to being able to report more on that at our next AGM, as well as obviously in our boards throughout the year going forward. Next slide, please. So just a couple of final pieces. We said during the pandemic that CHS doesn't stand for the Coronavirus Health Service or Health Services. It stands for Croydon Health Services, and it's important just to remind ourselves that COVID is not the only issue or priority that we have. We are here to provide a comprehensive service here in CHS, but also with our partners right across Croydon. A couple of examples there of the first female genital mutilation clinic and the recent development and the introduction of life-saving HIV tests, which we're able now to offer right across our population. And the biggest ever flu vaccination programme is going to be very soon upon us too. So it's not just COVID, there's many, many other things that we're doing, and again, more to be said on that next time round. Next slide, please. So coming to a conclusion, Elaine referenced this earlier. I wouldn't have minded her stealing my thunder, not least because she's providing SRO support for the Paediatric Integrated Unit, but it is a fantastic opportunity for us to do something similar to that we've done with adults and children in the emergency department, but create a comprehensive integrated paediatric facility, really important for a borough such as Croydon, where we have one of the youngest populations in the capital. This is a major project, major investment, and we've secured that, but the lily pad appeal are also coming on board to help further fundraise for this initiative, and if you want to donate through that or the Cancer Trust, then please do so. You can see there on the slide that you can visit the Trust website or text donate CCT41 to 88802. So please, if you are keen to do so, that would be fantastic. I am doing a small bit of fundraising myself, more on that next year. Hopefully I'll have completed it a couple of weeks ahead of the next AGM, and by that point I might even be walking again, because I've committed to running 100 kilometres in a race next September. So hopefully that will see me fit for next year's AGM. I'll conclude by just reminding ourselves of our overall approach here in Croydon, which is excellent care for all at home, in the community and in hospital, with our staff providing professional, compassionate, respectful and safe care. So thank you very much everybody for your presentations. Thank you to Pani for his fantastic contribution, and I'm now going to hand over to the chairman for questions.
Matthew, thank you for that whistle-stop tour of the future, including highlighting your 100-kilometre run, which we all look forward to you training for. Can I ask exec directors and non-executive directors to switch on your cameras so that we can, so the public can see you all, but keep your microphones on mute unless I ask you to make a contribution. I've had a couple of questions coming through in the Q&A chat feature, and the first couple, whilst Matthew has talked quite a bit about the COVID preparations, our Gold Command was led by Elaine Clancy, our Joint Chief Nurse, and I'd like to ask Elaine just to give us some highlights of some of the things that are happening at ward level in terms of preparing for an upsurge in COVID, and whether or not that includes getting ready to receive an OBE.
Clearly not an OBE if I can't work some simple technology. We've done a lot of learning from the first pandemic, and done a lot of reflection and lessons learned, talking to staff in different individual groups, collectively and multidisciplinary, to see how we can improve on our response for any further surges. We've done a lot of training with staff, as Matthew alluded to. A lot of staff were redeployed, so some of our community colleagues who work out in the community where services were temporarily suspended, those colleagues came in to the trust and worked on wards. Many of those colleagues hadn't worked on an inpatient hospital ward for a significant amount of time, and they did that very quickly with some immediate training, but we've over the summer managed to do some more training with staff, and in particular with some of the breathing apparatus and machines that we would use in treating patients with COVID. We've now got a log and systems of who's been trained on what and those sort of things, so that we can plan our staffing rotas hopefully a little bit better for this time. Our staff have hopefully had some rest over the summer and some time off. That's what we've been encouraged to do, and we've trained and we're talking to people on a daily basis, reviewing our training, reviewing our learning, reviewing wearing of PPE equipment, looking at staffing rotas, preparing for what may or may not come over the coming weeks and months.
Elaine, thank you for that. I'm going to ask Nena, there's a question in relation to health inequalities, and it's a really good question because it's about what people can do themselves to tackle health inequalities in the borough. So some highlight answers there would be incredibly good, particularly if you want to focus in the short term on what people can do to build their resilience in the face of COVID.
Thank you, and actually thank you for the person who asked the question who put 4 N's in my name, so thank you very much for spelling it correctly. It is an important question, and some of this was actually debated at the forum I shared with you amongst individuals who are asking about diabetes and hypertension. So if I maybe give some of the answers we got from there around the things we can do to modify the short-term risk factors. There is a really important element to do with diet and food. And I myself, in the face of COVID, have really started to think carefully about my predilection for eating sweet things and about my portion control. I have had colleagues who have themselves engaged more with exercise and making sure that you maintain a certain level of fitness, which is good for your heart, it's also good for your weight, it's also good to reduce the risk of many other conditions. For those of you who have long-term conditions, this is how you work with healthcare professionals and non-healthcare professionals to ensure that you are complying with treatment. So I shared a story, my dad's not here to hear this, so I can do it without any punishment, around, he modifies his doses of metformin without any discussion with his healthcare professional, but those doses are there for a reason. And so complying with your treatment, engaging with your healthcare professionals, really, really important. I would say education is huge, and that's education about what the risk factors are, what you're more likely to get, you sort of early identification, early diagnosis, making sure you have the health checks as far as possible, and then what's within your gift to prevent. If you are eligible for the flu vaccine, have the flu vaccine. Those are some of the things that I would suggest as individuals we all can do to improve our health and reduce the gap in terms of health inequalities.
Thank you for that, Nana. That's really, really helpful and useful. We've got a question in terms of patient engagement from Gordon at Healthwatch, and I'm going to ask for a couple of sentences from both Neil and Josh in terms of the way in which we're engaging our communities more. Neil, Josh, which of you wants to kick off first?
Yeah, I can. That's okay. Yep. So this question was around, this was Gordon's question, is that right?
Yes, indeed.
Yeah. So we do this in a variety of ways, and we do it, I guess, in two ways. So on specific service developments, we always seek to engage with users of those services and associated groups in the community. We also have a number of ways of drawing feedback from the community on an ongoing basis as well. So, for example, as part of our work as part of the South West London Integrated Care System, we have contributed to some community insights work that has really helped us understand the experience, particularly throughout COVID, some of the experiences for some of the service developments like online approaches and things like that. And it really enabled us to reflect on how those have gone, and as we look to make them sustainable, make sure they're accessible to people throughout the community. We also do a lot of good work with Healthwatch directly through things like One Croydon. We're also hugely benefiting from the great work done by some other organisations with us, for example, the BME network in Croydon, around people's experience of services. So we try and keep it as an ongoing process. And I think Neil will probably want to talk about how we've done that as part of our health inequalities work.
Thank you for that. Neil, you've had a prompt.
Thank you, Mike. I was struggling to find my how to take myself off mute, hence the pause. Yeah, I'd just like to add to what Josh said, in that we are working really hard to build on the good work we've already done to connect with the voluntary sector, because I think one of the best ways that we can engage with the public is through the voluntary sector. So there's been plenty of work already working together on service delivery, but what we're looking at now is how we can make connections with small and large voluntary sector organisations a much bigger and more routine part of how we think about our services, get feedback on them, and deliver them as well. So just to add to Josh's point, I think much greater connection with the voluntary sector in general is an emerging and growing part of what we do.
Fantastic. Thank you for that, Neil and Josh. And it's good to have both of you getting a speaking role today as well. We've had a question about how to donate to LilyPad, and rather than answer that, I'm going to ask that we put that up on the website so that people can quite clearly find ways of donating to that, or more generically, I think, to the Just Giving website for Croydon Health Services. But we know that people will be quite keen to donate, particularly to the development of the integrated paediatric unit. I'm going to move on to our final couple of questions, and I will do a thank you for Debbie at the end, because it has been fantastic having her with us. And when we see her here, it makes me realise if we were really committed to health inequalities, we should have been doing this a long, long time ago. So thank you again, Mena, for flagging that up. I'm going to pass across to Matthew for a couple of final comments. There's a question about whether he can really run 100 kilometres, and I think we all think he can. But there's another question which is actually about his biggest ambition for the year ahead, and I think it would be really useful to capture that. So over to you for the final answer of the night, Matthew.
Thank you, Mike. It's rare I get the final word anywhere in my life, so I'm going to take this opportunity and milk it for all it's worth. So there's another question as well, Mike, in about people not contacting services, and what's the advice to residents who have COVID symptoms. I'll start with that. Other colleagues might want to add. I mean, if you have symptoms, then you obviously need to make sure you're self-isolating. That's the first important point. You need to get yourself a test to see whether or not indeed you have actually got the virus, and if you have, then you need to follow the advice that you'll be given in terms of self-isolating until those symptoms have passed. Clearly, if you get the test and you've not got symptoms, then fine. I think there's a second part of the question, which is people not contacting services. We definitely saw at the start of the pandemic a period where our referrals reduced, both on emergency care and planned care. It's good news that in many areas, cancer being a good case in point, that our referrals are now back to the levels they were pre-COVID. And I would say to everybody listening that the health service is open, ready for business, and here to look after you. So if you have got a concern, then you should access your GP. Absolutely, they're the first port of call. They will be able to refer fully to the to CHS for medical or surgical treatment, physio, OT, nursing care, etc. We are fully open, and that absolutely will remain our position over this next period. So please, the population of Croydon, if you need healthcare, we're here. That is our job, to provide it. We're going to do everything we can to make sure that patients, the public, are kept safe. That's why we've created the Croydon Elective Centre to separate planned care away from emergency care, but we are following all the appropriate guidance in terms of infection prevention and control whilst in any of our services, and hopefully that should reassure our patient population that they can and should access healthcare should they need it, wherever they need it, at whatever level within Croydon. So hopefully that's answered Robin's question. In terms of can I really run 100 kilometres, the answer to that is I don't know yet. I haven't tried it, but I'm going to give it a darn good go. I have done other ridiculously stupid endurance events in the past, but quite a long time ago. So what would it be, 8 years ago, when I pretend to myself that I was a young person. I was clearly middle-aged then. I'm just older middle-aged now. So we'll see how it goes. The training is going to be fun. I'm going to be running from London Bridge to Croydon on a regular basis, I can tell you. So I'll let you know next September how it's gone. But my pride and stubbornness will mean even if I can't run it, I'll crawl the last kilometre if I need to, for the benefit of my own sensibility and also, more importantly, the lily pad appeal and our paediatric integrated unit. So that's probably enough on my ridiculous challenges. In terms of my biggest wish for 2020-21, I'd say continuing the work that we've done on a number of fronts, Mike. Firstly, the engagement and way that we're working with our staff across CHS. I've been really proud of what they've done, but I've also been really impressed by the work that, as a leadership team, we've tried to do, and I think with some success, to better engage with staff, and a more engaged, supported staff provides better care for patients. And ultimately, that's our job, is to provide better care to our patients. And so my ambition would be to continue, develop that support for our staff, and as a result, be able to translate that into better care for our patients. And my second ambition would be to absolutely continue to drive our integration work. I think it is a massive opportunity for Croydon that doesn't exist for everybody across the NHS or indeed in London, but it definitely exists here. And partnership working is a real thing in Croydon, and it's the way that we, I think, will put the health and care services in Croydon on the map for the benefit of our patients first and foremost, the public that we serve, and our staff. So that would be my second ambition. And the third ambition, from a personal perspective, would be to carry on enjoying the work that I do here in Croydon. I think it's a fantastic place to work, and I would encourage anybody listening who was interested in coming to join us to do exactly that. So that would be my my three wishes. If you're the genie, Mike, to grant me those wishes, I'll be very happy.
But there are other words you could use other than genie, but I'll take that one. Matthew, thank you very much. In terms of this evening's event, clearly we hope that you've enjoyed our celebration of our achievements. We hope that you found us open and honest as we presented some of the challenges that we faced. I hope that you found that we've given you a clear articulation of our vision and plans for the better health and well-being of everybody in Croydon, for all communities, for all individuals in Croydon. A big thank you to my exec colleagues who presented tonight. Thank you to Josh, Neil, Michael and Lee and all of your teams for your hard work throughout the course of the year. Thank you to my non-executive director colleagues who have been a tower of strength to me through the last year, and I know have been provided valuable support to non-executive, to executive directors as well. I'd also like to mention a couple of other people who've been quite critical in our journey and in the work we've been doing towards integration. Dr. Agnello Fernandez, our partner from the CCG, the chair of Croydon Borough Committee CCG, has been an absolute staunch ally of the Trust and of our drive towards better healthcare in Croydon. So too has the leader of the council, Tony Newman, who again has been absolutely supportive of our drive to health and care integration and joining up services to better support the people of Croydon. There are many, many others who've also provided invaluable support on that journey, but those two individuals, because of their leadership roles, have been absolutely critical to the journey, and without their support we could not have made the same sort of progress. I'd like to thank Debbie for the BSL interpretation throughout the meeting. Debbie, you must be exhausted. You've been fantastic, and some of our speakers have spoken very, very quickly. So thank you for that. Thanks to the comms team who have pulled all of this together. You've done a great job. This was our first virtual AGM. We would love to get feedback from you to make sure that we can make events like this better. Whilst we hope that next year's AGM will be face-to-face, we will want to make sure that we can continue the opportunity for people to join us remotely in order to extend access to our events. Please provide any feedback back to the comms team. I know they would welcome it. My final thanks is actually to you, the members of the public who have joined us today for this meeting, and more generally to the people of Croydon for their incredible support of the trust of our work over the past year. And finally, to our staff, many of whom are both staff and residents in Croydon. Thank you all. Good night, everybody. And I don't need to say safe journeys home for anybody other than our exec team. Take care. Bye-bye now.